Carotid arteries are the two major arteries that are responsible for carrying oxygen-rich blood from the heart to the head, face, and brain. These important blood vessels can be compromised if there is a buildup of fats and cholesterol, known as plaque, inside the artery wall. In this video, we'll be talking about carotid artery stenosis. Carotid stenosis is a narrowing of these carotid arteries due to a buildup of plaque inside the artery wall that reduces blood flow to the brain. Imagine your cardiovascular system is like a plumbing system, and your arteries are the pipes. The plaque can be represented by the buildup of waste in the channels, which can lead to a clogged pipe over time, preventing the water from flowing smoothly. Just like the clogged pipe, stenosis can worsen over time and completely block the artery, which prevents adequate blood flow from reaching the brain and may lead to a stroke.
Carotid artery stenosis can be hard to detect as there may be no symptoms in the early stages of the disease. The first signs of carotid artery stenosis could be experiencing a stroke or a transient ischemic attack. This is a temporary shortage of the blood flow to the brain. Following either of these episodes, symptoms that could present themselves are sudden numbness or weakness in the face or limbs, usually on one side of the body, trouble speaking or understanding, trouble seeing out of one or both eyes, dizziness or loss of balance, and severe headaches with no known cause. In order to diagnose carotid artery stenosis, a physician will perform a full physical exam and will specifically listen for swooshing sound known as bruit over the carotid artery in your neck. This sound is characteristic of a narrowed artery. Additionally, a doctor could perform an ultrasound to check the blood flow and blood pressure in the carotid arteries, or a CT or MRI scan to look for evidence of a stroke having occurred. Another procedure the doctor could use is a CT MRI angiography. This provides doctors with images of the blood flow in the arteries by injecting ink into the vessels, and then photos are taken of the vessels. If they can see the ink as expected, then there is no obstruction or narrowing. But if there is an absent area where the ink should be, or it is lighter than normal, this indicates an obstruction or narrowing of this artery.
There are 3 different ways to treat carotid artery stenosis: lifestyle changes, medication, and medical procedures. Starting with lifestyle, things like diet, exercise, and smoking all affect the severity of the disease. The best way to prevent further buildup of plaque in your arteries is by avoiding fatty, salty, and sugary foods such as fast foods, sodas, and desserts. Smoking and drinking alcohol are discouraged not only because they are bad for your overall health, but because they can greatly worsen the condition. Exercising regularly is highly recommended because it will help to control blood sugar and lipid levels and help you achieve and maintain a desirable weight. To make sure you're on the right track, it is important to see the doctor regularly and have your blood tested to measure the amount of cholesterol in your blood, also known as a lipid profile. Another way to treat carotid artery stenosis is by taking medications. The main types of medication prescribed are antiplatelet and anticoagulant medications. These kinds of medications prevent your blood from sticking together and creating a clot that can potentially block the artery, stopping blood from flowing to the brain. In the case of an emergency, or when medications and lifestyle changes aren't enough to combat the symptoms of carotid artery stenosis, medical procedures may be necessary. The non-surgical procedure that can be done is carotid angioplasty and stenting. In this procedure, a deflated balloon attached to a tube is inserted into your blood vessel and positioned where the blockage is located. Once in place, it is inflated. This pushes the plaque to the side, widening the artery and allowing for more blood flow. In addition to the balloon, a wire mesh tube or stent may be placed at the site of the blockage. When the balloon is expanded, the stent stays in place to help keep the artery open and prevent further narrowing. Another common procedure that can be done is carotid endarterectomy. This is a surgical procedure which involves the surgeon cutting into the artery and removing the plaque to reduce the risk of stroke.
As mentioned before, carotid artery stenosis is caused by the buildup of plaque in the walls of the artery. Plaque buildup such as this can cause the artery to clog, therefore not letting blood pass through. Blockage of the carotid artery in particular is very dangerous as it causes a reduced amount of blood flow to the brain. Lack of blood flow to the brain can cause serious damage in the form of a stroke. The risk of stroke increases due to the reduced blood flow and the deformation of the artery itself, which can cause clots. These clots are also dangerous as they can break away from the carotid artery and travel into smaller arteries, cutting off blood flow in different parts of the body. Carotid artery stenosis is most common in elderly populations. Before the age of 75, men are at a higher risk of developing the disease. After 75, the risk for men and women is relatively the same. It has been shown that this disease causes 20 to 30% of all strokes in the United States. Risk factors for carotid artery stenosis include high blood pressure, high cholesterol, and a history of cigarette smoking, which increases your risk by 8 times.